Thank you. I'm very excited to talk about this topic for multiple reasons. One is because it's as a surgeon who specializes in GI conditions, I've really gained a great appreciation for how cannabinoid therapy can help people with a variety of conditions. The other thing is that I feel that this is one of the most overlooked areas of where we can harness the therapies of cannabinoids, okay? We know that our gut health is integral into our overall body health, okay? So I've been incorporating cannabinoid therapy into my surgical and medical GI practice now for about 8 years. And really this came, and I'll talk about this a little bit more, about how I stumbled upon this. I'm a very classically trained medical doctor. So, briefly about my background, I graduated from medical school at Loyola University of Chicago, went on to do my general surgery training at Brown University, and then did additional gastrointestinal surgical training for my fellowship at Brown University as well. And so, again, coming from a very classic, traditional medicinal background, to go into something like this has been quite an adventure. But I also feel that doctors, maybe even one particular doctor, is one of the reasons why it's taken us so long to understand this. Now, what do I mean by that? Well, we know that cannabis was prohibited in the early 1900s. And there was a physician by the name of Abraham Flexner. Now, Abraham Flexner was assigned to survey all the medical schools in the United States as well as in Canada and get surveys about what do they think about medical cannabis. And what he concluded in his report was that there's not enough scientific research right now in order to support its use. Now that, unfortunately, and we don't know, there's a lot of political, potentially some political corruption which went on with this to try to put out of business a lot of the schools which were training people in herbal therapy, to push them into the whole, allopathic, form of medicine. So I'm very excited to be part of this, to try to bring this back into the mainstream and say, you know what? They were wrong, because shortly after marijuana became illegal in 1937, despite the Flexner report, there started to be studies which came out that said, you know what, there is real value to cannabis. But unfortunately, that ship set sail when it became illegal and we lost the ability to study it. So this is my, most of my days spent here. And then, ironically, then I go see patients, and then I'm starting to talk about things like this. I'm talking about their complex surgeries, and then talking about cannabis plants, gummy bears, smoking joints. I mean, it's just a wild experience. And the way I used to vision this is that, for my patients who had end-stage cancers, because one of my areas of expertise and what I specialize is in gastrointestinal cancers and operating on these conditions, inflammatory bowel disease as well. And so I used to find it as a way to provide patients with relief. They had end-stage cancer. I said, what's the wrong with them getting high or euphoric from, cannabis therapy? And so that's why this used to be a single arrow about basically just improving quality of life. But now I've turned this into a double-sided arrow. And the reason is that through the use of this, I've actually been able to avoid more surgery on patients. And that has been really, eye-opening. It's, hurt my business a little bit, but at the same time, it's very exciting to be able to keep people out of the operating room, because people don't want to be operated on if they don't have to be. So how did I learn about this? Well, I'm in the state of New York, and New York did not legalize cannabis for medicinal purposes until January of 2016, okay? So prior to that, I had patients who would come to me, and if those of you are familiar, just by show of hands, are people familiar with Crohn's disease, ulcerative colitis, right? It's an inflammatory condition where your body attacks itself. And some of the medications we use for these ailments they can be quite toxic, and they can have significant side effects associated with even malignancies. And what happened is I found patients, as a physician, I like to think that I'm pretty approachable, and I develop good relationships with my patients. They started to have this admission of guilt, where they would come back to me and say, "Hey, doctor," I would say, "Hey, you didn't refill your prescription on this medication for your Crohn's disease. Why not?" They said, "Well, I've got to be honest with you. Yeah, I've been using marijuana, and it's been helping me more than anything you've been giving me." And I was like, "Whoa, can I have this conversation? Should I be having this? Having this conversation?" But I knew there was something to it, and I start to then begin to realize that people are utilizing this because not just because they wanted to get high, because it was truly altering their diseases. And so most of my experience initially came from inflammatory bowel disease, cancers, and the problems that are associated with cancer, such as pain, nausea, and then this huge interest in whether or not cannabinoids can be used to actually treat cancer as a chemotherapeutic agent itself, irritable bowel syndrome, and then chronic surgical pain. And it left me with what I define as my cannabis medical dilemma. And that was patients would come to me and say, "Doc, this is working. Tell me why." And I didn't have any answers for them. So over the past 8 to 10 years, I have scoured the literature. I spent a great deal of time going through all this to try to figure out, how can I explain this to my patients? How can I explain it to myself? And then how can I then incorporate that into further therapy? And I also needed it because, particularly, as you're probably aware, you'll see there's a few doctors, medical doctors around, but there's still a big bias against this. Medical doctors that are classically trained don't want to hear that a plant can help them, help their patients, because that's not the way they're trained, and it's a whole new realm for them. And so I needed answers for myself, my patients, but then also to be able to go to other doctors and say, "Hey, listen, there's science to this. Don't discredit it. We have a lot to learn." And so as a result, I give local, regional, and now national talks on the benefits of cannabinoid therapy. And so one of the things, before I really got into it, and even though I read all the literature, I said, is this real? Are people making this up? And then, of course, then I went on to design my own product line of non-THC-based products, just being in New York State, CBD products specifically. So I decided that before I jump into this realm and admit to my parents, who it took me about 2 years to admit to them that I was doing this, that I took a trip to the kind of the heartland, of ground zero of where cannabis research has started, and that's in Israel. So I traveled to Israel, to the Hebrew University. Does anybody know who this guy is? Dr. Raphael Mechoulam, the godfather of cannabis research. If it wasn't for him, we would not be in this room today, okay? And so I went there. Now this is, you can see him guessing probably in the 1970s, my guess. This was me with him just about a year and a half ago. But look at what he's got on his drawing board. People still use chalk. They were using chalk back then, so clearly it was a little while ago. But guess what he's got? Cannabidiol. And he was talking about it, and he discovered cannabidiol in the early 1960s, and subsequently the year after that went on to discover THC. So you can see this is a medical center, and even by U.S. standards, this is a real institution. And this building right here specifically is a 6-story building dedicated to the science of cannabinoid research. Each floor is dedicated to a particular ailment, whether it be metabolism, cancer, pain, inflammation, neurologic disorders, mood disorders. And so I spent time in the lab going through and saying, you know what, this is real. The science they're doing is real. And so there's validity to that. So currently in our practice, although I'm a surgeon, and now I've had to kind of take on some other providers in my practice who I train to treat patients, but we currently have over 1,800 medical cannabis patients, accounting for over 6,000 visits. And this number is higher because this slide was updated, it hasn't been updated in a couple months. We have about a 90% success rate. Now, what I will tell you is that initially when I was doing this, we had about a 70% success rate. Now, you have to, success is how you define it, right? But the way that we've defined it is, one is that if they continue to use it it's going to be nice. We've shown decreased opioid pain medications, decreased nausea medications, particularly when it comes to chemo-induced nausea, decreased epileptic symptoms as well as medications, and as well as one that we cannot overlook, which is quality of life. But what drove me into the CBD industry was that I found about 20% of my patients were coming and saying, we don't want THC products, we want CBD. And I'd say, why? Well, several reasons. They don't want the stigma, they don't want the high, they don't want to test positive for THC, and you know what? They actually preferred the beneficial effects they got from CBD products as opposed to THC products. And also, I'm in Lake Placid, New York, from home or where the Winter Olympics have been, and so we still have an Olympic regional development organization there, where I work with a lot of the professional athletes, whether they be bobsledders, ski jumpers, you name it, any winter sports. I'm dealing with patients, and additionally, we have triathletes that use our products. And of course, we actually have a spokesperson who is winning all the Ironman triathlons who uses our products on a regular daily basis. But of course, one of the things that she cannot have is she cannot test positive for THC. So it's been really exciting to say, there's this large segment of population that benefits from cannabis therapy, and then there's this subset of population which really benefits primarily from CBD, and they may not need any THC at all. So what I want to talk to you, in this short time together that we have, is I want to talk to you briefly just about a little bit about the anatomy of the GI tract and what we call the brain-gut axis, a little bit about our intestinal anatomy, and then how this anatomy plays in with our endocannabinoid system, and then how cannabinoids interact with our GI system. I also want to talk to you about this whole idea of the gut microbiome. Everybody's familiar with probiotics. Do they work? Do they not work? What role do they play? But also, how do they interact with our endocannabinoid system? And then I'm just going to briefly talk about CBD and cannabinoids for some specific GI symptoms and ailments. So what is the gut-brain axis? How many people ever here have been very anxious, nervous about something and say, uh-oh, my stomach's bothering me, right? Everyone's probably been there. People travel, their lifestyles change for a minute, and they may have problems with their bowels. They get constipated, they get heartburn, they get indigestion. Well, why is that? There's a direct communication, a very, very, very complex communication between our brain and between our gut. And our gut has more nerves in our entire GI tract than our entire brain does. So when we're talking about all these conditions, whether it be pain, epilepsy, all these things that are focusing on nerves, what better target than the gut if it has more nerves than anywhere else in our body? So and we know that they communicate, right? So our brain may sense something, stress, anxiety, and it influences our GI tract, motility, secretion, our microbial balance within our gut. But then also the health of our gut through gut flora, as well as how other stress we're in, then relays messages back to our brain. So you can see that if this isn't controlled and it's just out of control, well, people are going to have problems both here and here. And I can tell you that treating patients with GI conditions, a lot of times GI conditions go hand in hand with a lot of psychological or psychiatric conditions as well. And you say, well, what came first, the chicken or the egg? Is it the fact they have a problem here that's affecting here? Or is it a problem here in the gut that affects here? And the reality is we don't know, but we do know that if you can interact up this cycle and provide health to this gut-brain axis, then we can take true advantage of that. And so the brain-gut axis contains of the brain, the spinal cord, which goes down to the gut, and then off the spinal cord we have all the nerves which go to our guts. There's multiple chemical messengers, but the also thing we remember is that it doesn't just affect our GI tract. It also affects other things, our liver, spleen, pancreas, which I won't get into too much in this topic, but so let's talk briefly about the intestinal anatomy. It's plumbing 101, okay? You got stuff you put in, goes in one end, uses what it needs, and it comes out the other end, right? So if you look at it, it's a tube of muscle, right? And so this is that tube of muscle. This is a picture of a diagram of our small intestine. And our small intestine has blood flow, of course. It has nerves, of course. And nerves, there's two types of nerves. There's motor nerves, which cause our intestines to contract. And then there's sensory nerves, which sense trauma, inflammation, and things. And then that sends a signal back to our brain. But not only do those nerves, that what we call motor nerves, control the motility of our intestines, but they also control the secretions of what our glands within our GI tract will secrete. So you can see that it works at really multiple levels, and right now I'm talking about these kind of nerves, and so we'll take a little bit deeper of a dive. So now if you take that small intestine, so if you were to take a little camera, we do things called capsule endoscopies. You swallow a little pill cam, and it goes through and takes pictures so I can look to see if you have disease of your small intestine. This is a depiction, but this is really what it looks like. It's all these little hair-like, finger-like projections which we call villi. And villi increase the surface area of our gut to help us absorb stuff. And if you don't have a healthy system here, your absorption and your GI system will suffer the consequence. And then if you take that and break that down even closer, so these little finger-like projections are these finger-like projections, and again another finger-like projection. On top of this finger-like projection, which is one of these, then it's broken down into either smaller finger-like projections, not called villi, but now called microvilli, just smaller. And the microvilli are on top of our epithelial cells, and our epithelial cells are what are responsible for absorption, and they're our first line of defense. You know, anytime we eat something, we know we're consuming bacteria, pathogens. I don't care how well it's cooked and, how healthy it is, but, even breathing in air, or, taking a sip from your cup of coffee that, had a germ on it. Our GI tract is our first defense mechanism. So if we don't have a healthy defense mechanism, well, we're going to be unhealthy. So within the lining, this is a smaller picture of the previous slide of that cell, we know that there's multiple endocannabinoid receptors. We all talk about cannabinoid type 1 receptor, cannabinoid type 2 receptor, but right now we know that endocannabinoids and plant-based as well as our natural endocannabinoids interact with a host of endocannabinoid receptors, and all have different purposes. So what is the job of the endocannabinoid system in general? It's meant to keep us in homeostasis. Now, what's homeostasis? Well, it's an area. What it is it's a constant, steady state of our body that we're able to maintain under times of stress. Stress is normal. We're human beings, right? Whether it be emotional stress that causes anxiety, depression, things like that, we have to find a way to reel that in, or else it can control our lives, right? Same thing, with our gut. If you have an unhealthy gut, we have to find a way to maintain that normal homeostasis, and this is one of the roles the endocannabinoid system plays. And how does it do that? Well, multiple mechanisms. One is by protecting our nerves. One is by modulating our immune system. We talk about cytoprotection, which is actual protection of individual cells, protecting us against cancer cells, and a lot of that links back to our immune system. It helps regulate our metabolism, nutrient transport, lipid metabolism, energy storage, and then regulates our intestinal motility and function. So when you look at the endocannabinoid system, we talked about the gut-brain axis, right? So let's start talking at the brain first. Really briefly, we know that the endocannabinoid system is found densely within the brain, and one of its jobs is to modulate food intake. So our central nervous system in our brain is responsible for food reward behavior. We also know that peripherally in things like our intestinal cells, as well as our fat cells, our liver cells, our pancreatic cells, we know that there's communication to these cells which help us control, regulate our metabolism, our motility, how we decide to either store fat versus break down fat, how healthy our liver cells are, pancreatic cells when it comes to things like diabetes. But in the brain also we have this hypothalamus and pituitary gland. And what their job is they talk to each other, And they have to be healthy because then what they do is they send signals to our adrenal glands. And everybody who's in this health, in this holistic space, we know that one hot topic is adrenal problems, adrenal insufficiencies, and the implications that have. So if you have an unhealthy hypothalamus and pituitary gland, you're then going to have an unhealthy adrenal gland system, which can have multiple implications on our GI system and our overall health as well. So let's take a closer look at our cells within our GI tract, okay? You have the large intestine and the small intestine. The large intestine doesn't have these big villi, these big projections, but what we know is that throughout the GI system, again, I'm going to focus on just a couple receptors here, the ones that people are most familiar with, and one is the CB1 receptor, the cannabinoid type 1 receptor. It's densely distributed in our GI tract, okay? And one of the one of the things that it does is that if you look at the nerve cells which are responsible for motility and secretion, we know that the endocannabinoid receptor is co-localized with these nerves, okay? So, and this helps control the activity of our GI tract. We have different nerves. We have sensory nerves, which sense trauma, pain, inflammation, which then have to send a signal up to our brain to tell us that there's something going on. But then they also affects the motility, the nerves which affect our motility. Okay, so it could affect how well our gut is either going too slow or not slow enough. But then also these nerves are in the endocannabinoid system is linked to the nerves which control the secretions in our guts, which has implications for diarrheal conditions and a whole other slew of conditions. And when you activate the CB1 receptor, this can cause decreased intestinal motility, okay? Now, one thing that we know is that, for example, irritable bowel syndrome. People have irritable bowel syndrome. There's different types of irritable bowel syndrome, but the most common is diarrhea-predominant irritable bowel syndrome. People eat something, they get anxious, they get urgency, they got to run to the bathroom. So one thing that activation of the CB1 receptor can decrease our intestinal motility. The important thing I want to make about this, which I get questions about this all the time, is that does that mean that it makes you more susceptible to constipation? And the answer right now is no. And the answer say, well, maybe why? Why might that be? Well, a lot of it comes down to the fact that our body wants to be in homeostasis, right? So we know that as long as we can keep our endocannabinoid system healthy, well, it's going to help us control GI motility to not be too quick, but also not to be too slow as well. We also know that it decreases, gastric acid secretion. So people suffering from heartburn, reflux, gastric ulcers, there's a role for it, as well as decreasing sensory pain signals. What about the CB2 receptors? The CB2 receptors are found, again, very densely in our GI tract. Again, why? Because our GI tract is our first line of defense against pathogens, bacteria, virus. So we have to have a healthy immune system. Now, the immune system cells within our GI tract, here's just some of them, neutrophils, T cells, B cells, macrophages, basophils, they all play a role in keeping us healthy. And activation of the CB2 receptors decreases inflammation, it decreases further tissue damage, it decreases intestinal motility, and then it also plays a role in decreasing sensory pain. Because if you have inflammation, that triggers the nerves, the sensory nerves, which will send a signal back to our brain saying, my gut hurts. So when you look at CBD and cannabinoids for GI inflammation, we know that an unhealthy endocannabinoid system in your gut is associated, it's been shown over and over again to be associated with GI ailments. So for example, if you take a diseased section of bowel suffering from inflammation and you analyze that, what we find is that there's increased levels of the receptors, of the cannabinoid receptors. So our body says, I have sick gut, I need more cannabinoid receptors. So it increases that, and then it also shown that you have increased levels of our natural endocannabinoids, anandamide and 2-AG, which are the two most common ones. So clearly, inflamed, unhealthy tissue, one of the things our body does is it tries to help that by increasing our cannabinoid activity. And there's several ways that CBD specifically can do this. One, we talked about how it can bind to our immune cells to help them function properly. CBD specifically blocks the enzymes which break down not only our natural endocannabinoids, but some of our plant-based cannabinoids as well. So if we suffer from something called endocannabinoid deficiency syndrome, which is a hot topic which we're talking about, endocannabinoid deficiency syndrome means, well, the same way someone may be deficient in vitamin D and it causes fatigue, lethargy, and things of that nature, well, we know that endocannabinoid system can be the same way. So by blocking, one of the most beneficial things that CBD does, in my personal opinion, my professional opinion I should say, is that it blocks these enzymes which break down our natural endocannabinoids, which then increases our natural endocannabinoid tone to restore health. It also decreases the release of chemical messengers which further promote further inflammation. And then it also inhibits further tissue damage by decreasing the production of what we call reactive oxygen species and reactive nitrogen species. And these are toxic, very toxic compounds that our body produces, which can damage our DNA, drive to further inflammation and other medical problems. Now, when you look at pain in our gut, what causes pain in our gut? If you were to take a knife or something and cut your skin, it's going to hurt, right? Well, if we could find a way to magically jump into your belly and cut your intestines, guess what? You wouldn't feel that. You wouldn't have pain. We have very different mechanisms within our gut that control our pain. What our gut responds to is distension, inflammation, and contraction. So I'm sure everybody in this room has had an upset stomach, right? You get that feeling of, oh, it really hurts, it's crampy, it hurts, and then, people can have diarrhea and all this type of stuff, and then they feel better. And the reason that is because it's stretching out that gut, triggering those nerves to fire, to send a signal to our brain to say, ow, that hurts, right? So, and an example of how that does that is that cannabinoids can block the pain pathways by slowing down the communication between nerve cells. Nerve cells going from our gut to our brain go through hundreds of thousands of nerve networks to get all the way to our brain. And they communicate with each other by releasing excitatory neurotransmitters, the most common being glutamate. So glutamate causes that transmission from one nerve cell to the next. And so CBD and other cannabinoids inhibit the release of glutamate, which is why we know that it helps for pain for other conditions, but it also helps for pain from our gut. This didn't show up very well, but other ways that CBD can affect pain, not just from our gut, but also, in general, is that CBD in and of itself has a very low binding affinity for our cannabinoid type 1 and type 2 receptors. But one thing that it does is it works through something called allosteric modulation. What the heck is that? Well, rather than CBD binding to our CB1 and CB2 receptors to cause a direct effect, what it does is it alters the function. It binds to a different site of the receptor to reconfigure it in a way that it works differently. And there's something about the way that it works differently which has been shown to be beneficial, for pain. We also know that CBD binds and activates directly to our serotonin receptors. Well, serotonin is studied great, for anxiety, depression, Prozac, all the Paxil, they're all selective serotonin reuptake inhibitors, right? So we know that by binding to this, one is that it can potentially help if you have increased anxiety, which can trigger gut motility. Well, there's one way it can help. But then we know that it also helps with pain, appetite, nausea, vomiting, addiction, and sleep. But then it also binds to other receptors called vanilloid receptors. And vanilloid receptors are involved in pain and inflammation as well. So let's talk briefly about our gut microbiome. Okay? What I'm going to say is that I treat several conditions where I've struggled and beaten myself up for trying to figure out why I can't get somebody's gut to be healthy. And then I go back and I say, all right, I'm going to try you on something. I'm going to put you on probiotics. I'm going to put you on a cannabinoid supplement, and I want you to come back. And what we found is that this is extremely important because our gut microbiome, a healthy gut microbiome is very important to decreasing inflammation and increasing our immune function within our gut. So I generally say that healthy intestinal bacterial flora equals a healthy gut, which equals a healthy human. But it's a very delicate balance. You know, overproduction of too much bacteria, something that we're coming across is something called small intestinal bacterial overgrowth. There's people out there popping probiotics all day long, and if you have too much bacteria, well, that can cause a problem as well. So that brings us to leaky gut. Now, what is leaky gut? You know, I don't really like the term leaky gut, maybe just because as a doctor I don't think it has much science. It's not scientific enough. But again, the role of our gut is that it has to maintain a defensive barrier against pathogens. And unhealthy and inflamed cells, or if you have poor bacteria in our gut, causes increased inflammation, which damages the epithelial lining. But more importantly is that in between our cells, okay, there's these things called tight junctions. Tight junctions hold our cells together and they create a barrier. So it's kind of like if you had a raincoat and you punched a bunch of holes in it, rain's going to pour through your jacket. Well, a healthy gut bacteria as well as a healthy endocannabinoid system has been proven to improve the integrity of this tight junction. So therefore toxins can't make it into our system as well. And also for those that do and they enter our cells, we have to have a healthy endocannabinoid system to defeat those pathogens. So there's a growing number of evidence that autoimmune diseases and things of that nature are a result of this leaky gut and having permeability in our gut. And so CBD plays a great role in downregulating these chemical messengers, cytokines, which are associated with inflammation and disruption of our cellular integrity. So I'll go through these. I have 3 or 4 quick slides I'll go through. These are some of the conditions that you may face and be approached with if you're dealing with patients. IBD, which is an inflammatory condition, irritable bowel syndrome, GERD, colorectal cancer, cirrhosis, obesity, and metabolism. I'll just touch on a few here because I know we're running short on time. But what about cannabinoids for nausea, appetite, and cachexia? Endocannabinoids as well as plant-based cannabinoids act at 2 different areas. One is centrally in our brain by controlling how we interpret nausea, but then also the peripheral mechanism by saying, hey, if you're nauseated and when you want to throw stuff up, it helps calm our stomach down. We know that there's very good evidence that cannabinoid products, including CBD products, are associated with less side effects and and a lot of times can be just as effective as pharmaceutical medications. We have to be careful about routes of consumption because, depending upon somebody's GI tract, but the National Academy of Science and Engineering and Medicine in 2017 put out a report saying that there is conclusive evidence that oral cannabinoids are effective antiemetics in the treatment of chemotherapy-induced nausea and vomiting, and we've subsequently translated that into other nausea conditions as well. What about irritable bowel syndrome? We don't have tons of good randomized controlled trials, but I'll tell you anecdotally in my clinic, this is one of the biggest benefits that it has for patients, and there's been randomized controlled trials showing that it's associated with decreased abdominal pain, decreased urgency and frequency of bowel movements, increased quality of life. I would just say we have to be careful with terpenes because some terpenes, particularly in higher concentrations, can cause increased GI irritability. Last thing to talk about here is inflammatory bowel disease, which is an inflammatory condition. We have tons of preclinical research, meaning we have research on how this affects animals, cells, done in basic research. And we know that there is significant benefit by cannabinoids and CBD interacting with our cannabinoid receptors, TRPV receptors, PPAR receptors, which all basically, to make a long story short, decrease inflammation. In human models, we're gaining some outcomes in multiple non-randomized controlled trials, but are not ideal. But for those of us in this industry who deal with these patients, I can tell you that it works. Okay? So again, I want to stress the fact that I hear a lot of these talks, and one thing that I think continues to be overlooked is the role that endocannabinoids and CBD-based therapy can have on our gut, because it plays such an important role in our overall health. So we may be running short on time.
So I think I heard you say that you had IBD patients that stopped taking their immunosuppressants because the cannabis made them feel better. So I'm interested in two processes here. How does someone decide that it's the marijuana that's making them feel better and stop taking immunosuppressants, which can be a little scary? And then how do you go from having that empirical evidence to concluding that, yes, it's an actual thing?
Yeah, and that's a great question. It's something that's very hard to answer, because when patients have inflammatory bowel disease and they come back to my office and I say, how are you doing? Okay, there's two ways I know how they're doing. One is most patients that have inflammatory bowel disease know their body very well. They know if they're having increased abdominal pain, diarrhea, blood in their stools, and things like that. So that's one way that I say, how are you doing, with this therapy? The other option is that I have to stick a scope up their bottom, which a lot of people aren't just going to volunteer just for me to take a look. But what's been most profound to me and eye-opening is the fact that people will come back after I've been prescribing these medications for 6 months to a year, and they say, I gotta admit to you, doc, I've never taken that medication once. I've just been using marijuana. And with our inflammatory bowel disease patients, we have to survey them every 2 years, because we know they have an 8-fold increase of developing colorectal cancer. So when I go back, I'm always very intrigued to say, all right, I know you've been on cannabis therapy, you haven't done anything that I've recommended, and I don't blame you, because some of these medications are not very healthy for you. And I go, and sure enough, their inflammation is either completely resolved or at a fraction of what it was before they're using cannabinoid therapy. And then patients have to make a decision and say, well, even if I have a little inflammation, is it better for me to be on some of these really toxic medications, or should I just keep working on utilizing cannabinoid therapy? Does that answer your question a little bit? Okay.
I had a question, actually a two-part question. One, you mentioned that your patients are using marijuana. I was wondering if you see more efficacy with the THC versus the non-THC CBD?
I say that because that was initially my encounters. In New York State, prior to 2016, I had patients coming to me with two things. They would say, I just smoke marijuana from my friend that's growing in his backyard. And I say, well, I can't, first of all, I can't endorse that, because it would be illegal for me to do that. But then I had patients who were coming to the office and say, I've got this CBD which I purchased online. And I say, okay, you've been using it, is it working? And I say, it's fine. And they say, can you look at it and tell me if it's good? And I say, back in those days, which we're starting to learn about how transparency in products and consistency and quality in products are so important, that it became very difficult for me to give them guidance. And that's where I started doing my own formulations to try to provide product transparency.
The other question is I had regarding the specific CBD. Are you seeing any or better results with one carrier oil versus another? I know we have some people that say, oh, I like the hemp seed oil. It's a good fatty acid, much like an omega, like a fish oil, or versus a coconut oil, or what have you.
Not particularly. Everybody's going to respond to this differently. What I think is more important with GI conditions is that if you have inflammation, for example, in your gut, the likelihood of you absorbing a lot of this stuff can be challenging, right? And you may be wasting it wasting your money and your CBD right down the toilet, which is not doing you any good. So that's where it's more important. What I've found is that with people with really bad inflammation of their gut or bad problems, I will typically recommend like a sublingual in addition to an oral supplement to really try to attack it from both ends, or an inhalational form as well, as opposed to a tincture, to try to attack it from both ends. And some of that's their willingness to have disposable income to purchase multiple products.
Which inflammatory markers are you testing to assess decreases in inflammation, are you watching like CRP,
Yeah.
calprotectin?
Yeah, all of our inflammatory bowel disease patients, we check what we call ESR, erythrocyte sedimentation rates, as well as C-reactive protein levels. And now we're also checking stool levels of inflammatory markers, something called fecal calprotectin, which is an indicator of inflammation, not just for inflammatory bowel disease, but whether somebody has an infection, they'll have elevated levels of fecal calprotectin in their stool. So we are testing this, and that's something we're starting to look at and say, how can we develop a good trial, without going through big IRB approval processes and things like that in order to do that. So a lot of it we're doing through questionnaires and just retrospective data.
Have you been seeing decreases in those inflammatory markers?
Absolutely. Absolutely. We've seen significant improvements in our inflammatory markers, and not for everybody, because a lot of it depends upon how we respond to this. It all goes back to the fact we're all genetically different, and how our body responds to this is going to be different.
Have you researched or looked into a different delivery system to increase the absorption?
Well, that's going to be the challenge, and so for people who have severe, come to me with severe debilitating inflammatory bowel disease, they want relief, and they want relief pretty immediately, and that's where I find that like an inhalational form initially is a good way to get them started. A second being a tincture, and then the third being an edible, because I can't guarantee how much. Well, the edibles are appealing because it's directly coating, going right to the heart of the source, but at the same time, inflamed tissue doesn't absorb stuff as well as non-inflamed tissue, which is why people with inflammation get diarrhea. It just goes through them. So, right now that's something we're trying to figure out what's going to be the best delivery system for that. But, it's really a combination of a lot of different things, a lot of different routes of administration you can take advantage of.
You said delivery system makes me think of suppositories. Is that a method that you are using or considering?
Yeah. I'm not using it just because it's been a hard sell to get people to convince. There are huge advantages of using suppositories. The reason being is, one is that the rectal mucosa is extremely vascular. And we know there's been studies that have shown that the bioavailability of a suppository is almost superior to the majority of compounds we have out there. The other thing is that it avoids the first pass metabolism. When you consume something through your gut, your GI system absorbs it. In the first place, it goes to the liver, and that's true for the colon as well. Now in the rectum, so for example, if somebody develops small intestinal cancer or colon cancer, one of the first places it spreads to is to the liver. Why? It's because it's the first place the blood flow goes to. Where the lower part of the rectum bypasses that liver and that first pass metabolism, goes around the liver and goes to the lungs. Now that's why people with rectal cancer tend to get more disease spread to their lungs as opposed to their liver. But that concept of the fact that if you give it as a suppository, it's going to bypass the first pass metabolism, therefore increase the bioavailability. We've just had problems, I deal with so many colorectal problems and anorectal problems that it's not always easy to convince people to stick something up their bottom. But there's a market for it, and there's education and things of that nature, and it's something we hope to get to.
And the second part was gastroparesis. I've been hearing more of that. And your thoughts on help with that.
So I'm actually a referral center myself for gastroparetic patients. And for those of you who are not familiar with gastroparesis, it's a condition where your stomach doesn't empty. Food sits in your stomach, it doesn't empty, and we don't know why. It causes pain, nausea, bloating, all sorts of problems. Now, I'll tell you, and so currently our best treatment options for this, I put in gastric pacemakers. I do gastrectomies to remove part of their stomach. I do bypasses to their stomach, all sorts of efforts. We don't have any data on gastroparesis, and certainly the concern would be that if it slows down motility at all, could it potentially affect gastroparetics?